Hello, welcome back. Today we'll go through osteogenesis. Okay, so intramembranous ossification. That is when this occurs in embryonic development. A woven bone is first formed and then is replaced by a lamellar bone, and it is formed directly within the condensations of very vascularized mesenchymal tissue. And this all occurs at the primary ossification centers, like usually in the middle of the diaphysis. Osteoblasts will grow around, they will develop the capillaries, and that will grow into the connective tissue. Osteoids are synthesized and then mineralized, and the collagen fibers are kind of arranged all willy-nilly, and there are no lamellae quite yet. So here you go, there's the steps, there's the mesenchymal cells, the collagen, and here's the ossification center, and it forms the osteoid, and then inside are the osteoblasts. And then, one and then two. Bone matrix, the osteoid is secreted within the fibrous membrane, and the osteoblast will start to secrete the osteoid, which is mineralized within a few days. And then the osteoblasts are trapped and they become the osteocytes. The woven bone is formed when the matrix is mineralized. Osteoid is laid down between the embryonic blood vessels, and that will form the random network. And then eventually it forms trabecula. Vascularized mesenchymal tissue will condense onto the external face of the woven bone, and then that will become the periosteum. And then here, this is when it's all mature. There, the bone collar of the compact bone will form, and then the red marrow will appear. The trabecula just draped to the periosteum will thicken, and then that will form the woven bone collar that is later replaced with mature lamellar bone. And then the spongy bone, or the diplo, will consist of distinct trabecula, and it persists internally, and then the vascular tissue inside will become the red marrow. Secretion of osteoid and mineralization continues, and then it will enlarge the small bony areas. The ossification centers eventually grow, they fuse, then they replace the connective tissue mesenchyme and produce compact bone, and that will enclose the cancellous bone. And the layers of connective tissue not undergoing ossification instead will become the part of the periosteum and then the endosteum. Intramembranous ossification is the pattern of ossification of flat bones, and they contribute to the growth of the short bones, along with the maxilla, the mandible, the clavicle, and this will thicken the long bone. Okay, so the cranial flat bones. The bone formation predominates at the internal and external surfaces, and the trabecular bones are the diplo, and those contain the diploic veins that are valvulus, and the diploic veins are connected with the intracranial and the extracranial veins via these emissary veins. And those emissary veins are also valvulus, and they pass through the apertures in the cranial walls. Both of these types of veins will equalize intracranial and extracranial pressure, and they act as a safety collateral path during some kind of cerebral congestion or obstruction of the veins, and it cools the blood before entering the brain as well. The danger is these are incredibly dangerous routes for infection because they're valvulus and they penetrate quite deeply in the brain. Endochondral ossification takes place in the hyaline cartilage model. This is when the mesenchymal cells, the chondroblasts, will form an embryonic hyaline cartilage model with the perichondrium. And it first occurs in the bone collar, and the bone collar is produced by osteoblast that has differentiated within the perichondrium, transitioning to the periosteum. And it forms in the late in the first trimester beneath the perichondrium and around the diaphysis. It blocks nutrient and oxygen diffusion into the underlying cartilage, so those chondrocytes will hypertrophy and die, and that will compress the surrounding matrix and initiate its calcification by releasing osteocalcin and alkaline phosphatase. You can see here primary ossification, blood vessels come, and it forms eventually the epithelial plate. The empty space left behind by the generating chondrocytes are invaded by the periosteal buds, and the osteoblasts will move into the spaces in the degenerating cartilage. Osteoids will undergo the calcification into the woven bone, and that is later remodeled as the compact bone, and with the lamellae. The process is all in the primary ossification center, and the remnants of calcified cartilage are basophilic, while the new bone is acidophilic. Secondary ossification centers develop in the epiphysis, and the marrow cavity are filled with bone marrow. The cartilage model will gradually replaced by bone, except for at the epithelial plate and the articular cartilage. The growth and length will occur at the epithelial plate, and on the epithelial side, the chondrocytes will proliferate, while on the diaphyseal side, the chondrocytes will die, and then they'll be replaced by bone. Growth in width will occur through the appositional growth. Periosteal deposition is the growth of flat bones and the thickness of the long bones, and endosteal deposition is the growth of the trabecular bones and the endosteal cortex. Here are the zones. Bone deposition exceeds bone reabsorption, and that will increase the bone mass or bone density. Peak bone mass is reached by 20-25 years of age. Modeling changes in size and shape of the bone is a continuous process. Because of the ion concentration needs to be maintained, particularly like calcium. Remember, we were going through like how important calcium is for contractile movements. And in young adults, remodeling will begin with the localized reabsorption. And in young athletes, really, synthesis is like in equilibrium to reabsorption, and the remodeling rate is generally higher in the trabecular bone, and age-related loss is detectable in the trabecular bone, which is kind of why people shrink. Osteoporosis is the thinning of the trabecular network, as you can see here. Like, look how large these holes are. It's an increased risk for fracture because the bones are brittle. Osteopenia is the precursor to osteoporosis, and osteomalacia is when the calcium absorption is prevented by a vitamin D deficiency. Osteoid synthesis is normal, but the deposition is not. It's also associated with like rickets, which is also vitamin D deficiency. Okay, so during fracture, first the hematoma will form, and then it will be removed by macrophages, and then a soft fibrocartilage procallus is going to form, and it's rich in collagen and fibroblasts, and it's invaded by blood vessels. Actually, during this phase, this is when your bones start to itch. You can literally feel the invasions of the new vessels. And then the woven bone will form the hard callus as the bone is the fibrocartilage is mineralized. And then the woven bone is remodeled as compact bone, and it's cancellous bone without any kind of scar formation. And then vasculature is reestablished. Okay, so there's a bunch of different joints in the body. We went through them in anatomy, but just to kind of like fly through them again, there's the fibrous joints, which are the sutures, syndesmosis and gomphosis, cartilaginous joints, which are synchondrosis and the symphysis. Synovial joints they're vascularized, have a lot of smooth connective tissue associated with it. And then the villus connective tissue is covered by a layer of synovial epithelium that lack a basement membrane. And the villus connective tissue is really in like the intestines, not really in the joints, but I guess I just put that there because I ran out of room somewhere. But here are all the different kinds of joints. The synovial epithelium has two different types of cells. Type A cells, which are phagocytic cells, and that is more prominent in the reactive synovium. And type B, which are fibroblast-like cells, which secrete hyaluronic acid, and those predominate under normal conditions. Synovial fluid is made of hyaluronic acid along with glycoproteins. Any irritation will cause reactive changes in the synovium, and then that will activate the type A cells. Increased amount of white blood cells in synovial fluid will show some form of joint disease. Rheumatoid arthritis is the hyperactivity or hyperplastic synovial membrane, which transforms into pannus tissue, and that will invade the cartilage and bone, and that leads to a lot of pain along with joint and tendon destruction. Okay, so that's it for now. Thank you for your attention and good luck studying.